about our state is only the 30% of the healthcare is through the public departments like the PHC, CHCs, our taluk, district, general and medical colleges. Around 60 to 70% is catered through the private health hospitals, health institutions. And the decentralization had already started in our state way back, where the Panchayat Raj institutions are being given charge from the Grama Sabha, Grama Panchayat, then the Block Panchayat, District Panchayat. Our health institutions have been transferred over to them. So this is helping us a lot, because those Panchayat leaders who are aware of our programs, they are taking an active part, and we can at our grassroots level plan programs, and this helps in giving health care access to almost all people, because in we have this civil society meetings, workshops, along with the PPP model, private public partnerships, which is helping in our national programs like the RNTCP, HIV AIDS program, and it is more or less more important now in where the non-communicable disease control program has been brought about. Only 2 months back we have trained our doctors, we are implementing the program, and it relates to the lifestyle. So to change a lifestyle, it should begin from the grassroots, from the ward health sanitation or ward health nutrition committees, then the sub-center level action plans, where then our Anganwadis, we have the ASHA workers, again they are the link with the community, activities like food habits, then physical activity. This can be at their ward level itself, if a ward member is aware of it. And so that is important again in the area of capacity building. There should be a combination between the local self-government and the health department, so that combined trainings are there for the LSD people to know what is health, what is the role of the PHC, what is the role of the sub-center, district hospital, taluk. Then only they will be able to imbibe all the services that we are giving. Otherwise, if the PHC is like a hospital, if a member thinks it is a hospital, then you cannot do any work. But he has to realize that the PHC of its primary health care means curative element is only 1/8 of the all other elements. So if that is known to a Panchayat member, then he will take the field level activities, and he can also ask the medical officer to do a field activity if he is not doing. So that combined capacity building and awareness, mutual trust is important. If we involve media, if we make them aware of our what is the status of a disease or a health situation in the state, and what are the activities you are doing to reduce it, so they become aware of it, and they will know what all things they should promote. And if a bad report comes, they will work upon it, ask whether it is true, and then only publish it. And they can also, if they know that this program is important, if this activity is important to prevent a disease, they can highlight it through their media. That will again increase the awareness of the people, and people will also become more involved in the program. So it is always better to take the media into confidence before starting a new campaign, so that they will be aware and they will promote it, instead of starting a campaign all on a sudden. If you tell the media about what it is for, because it is related to health, everyone will be interested in it. So this training program on human resource in health for the managers for the administrators of our state is a unique one, and it's the first of its kind. Our state institute is the apex institute for this training in our state, which trains all the type of category of staff, starting from medical officers to the administrators. Basically, we give induction training, in service training to all the category of staff, and along with some specialized trainings like the supervisory management and the computer training. So this training is a need for our state, because our ultimate aim of the state health department is to give a quality health care to each and every individual in the state. And for quality care, we should also have, as the leaders, managerial capacity. And for that, giving them managerial training, we are in collaboration with the Public Health Foundation of India. From last May 2012 onwards, we are having different workshops where we have now developed an HR cell in the Directorate of Health Services, and with the HRH project is now have stakeholders. We have the Swasti Resource Center Bangalore, the PHFI, and the European Union. They have specifically asked for some topics like the media management, management of politicians, then conflict resolution, like motivation. So these topics have been included, and it is a participatory type of trainings, because it is in that type of training that you can really bring an attitude change for the resource persons. We are thinking that we can develop a set of trainers from this pool who can be used for further training programs, and so this will be a continuous program. We initially, for 25 people, this training was proposed, and then we'll give it to the other group of people, other administrators, not only medical officers. We have the nursing cadre, we have the district level mass media officers, like different cadres are there, so all will be in future.